There is growing concern this morning that COVID-19 is linked to another serious illness, one that is primarily affecting children. It's called Kawasaki syndrome, a disease potentially deadly that can cause inflammation of the heart, eyes, mouth, and skin. There have been cases in New York City and Europe, also in Canada. Close to 20 children have been treated in Montreal, and they're studying it there.
Some patients, it was tough. Some patients had to go to intensive care unit, yes. Some patients had an inflammation of the heart, yes. But so far, to my knowledge, all of them did well.
So that doctor from Saint-Justine Hospital, that's the children's hospital in the French hospital network, and it's working with the Université de Montréal to add more data to the research on the effects of COVID-19 on children. We're getting word about this condition at a time just before, for example, in Quebec, elementary schools and daycares are due to reopen in parts of Quebec. We also heard from the Sick Children's Hospital in Toronto. They as well aware of this new group of patients and are studying and watching very closely. Let's put that issue to our usual Wednesday guest, Dr. Samir Gupta, back with us, a respirologist in Toronto and an associate professor in the Department of Medicine at U of T. Dr. Gupta, always great to see you, and thank you for coming back today.
Pleasure.
So this is a story we first mentioned last week, and it's getting a little bit more attention with the focus on these children in New York City and again with these children in Quebec. So let's talk for a little bit this morning about Kawasaki disease. I mentioned some of what it is, but for people who are just relating it, what is it and why is it a concern?
Kawasaki's is a pretty rare illness that we see mostly in kids. And it's a type of inflammation in the body. It usually is caused by some type of viral illness, either respiratory tract or digestive virus. And once that virus passes through the body, it seems to cause an immune response. So our own immune system causes inflammation, and it's in very focused areas, as you mentioned. It seems to be the mouth, the eyes, sometimes the palms and the soles. It causes a rash, but it can also cause inflammation in the arteries of the body, and that's when Kawasaki's can be quite dangerous. What we're hearing about now with these cases is that it seems like many of these kids end up being positive for COVID-19, but they present with symptoms that are very similar to this pattern of inflammation we've just talked about. And we know that viruses can cause inflammation, and we know, in fact, that one of the ways in which COVID-19 can become dangerous in adults is because it causes inflammation. It causes our immune system to cause that inflammation in our lungs, and that's how people get sick. So it may just be that in kids, this virus is causing a very specific pattern of inflammation that's reminiscent of what we see with Kawasaki's.
That's so interesting. I was looking, there's actually a Kawasaki disease group, and the head of that was talking about how it's a presentation that resembles Kawasaki disease, and also about the thinking that it may be COVID-19 as a possible trigger for Kawasaki disease, and they may be some relation. So there's obviously going to be a fair amount of study on all of this. What could we learn about COVID-19 if we start to determine what this connection is in children?
Well, I think a couple of things. One is that we're still learning more about how COVID-19 affects kids. Initially, we saw many fewer kids sick from the virus, and the question was, are kids getting it less often, or are they getting it, but they're just fighting it off better? We now have some data from newer studies suggesting that kids actually do get it less often, but they also do seem to get less sick from it. But now we're seeing these very specific presentations. This is one of them. So it tells us that depending on the immune response of that particular child, they can have a more severe type of disease presentation. And we already know that in adults. We know that some adults will have no symptoms or very minimal symptoms, but then at the same time, some adults are really sick and in the ICU. And that seems to be mitigated by how our own immune system responds to the virus. So we're going to be able to learn more about that relationship between the virus and our immune response, and how that's occurring in kids as well.
So does that then take us away from thinking of COVID-19 as strictly a respiratory illness? Are we again having to look at it through a different lens?
I think we've already, moved on from that, at least in the adult world. For quite some time, we've known that the inflammation extends far beyond the lungs. The lungs are the most commonly affected site and the site that will often bring the person to medical attention. But the people that are getting really sick in the adult world, in the ICUs, we are seeing what we call multisystem disease. There's something called cytokine storm, where you can almost think of it as a storm of inflammation caused by our own body. And that inflammation can extend to many different organs. And one of the causes of death in adults is actually when the heart gets inflamed in patients with COVID-19. So absolutely, it starts with the lungs, and the lungs are often most severely affected. But the immune system can affect any part of the body. And it really is a multi-system disease in its more severe state.
Let me ask you, because you raised the question of children as carriers, transmitters, or indeed possible super spreaders, as that phrase exists. There has been some study done, and you mentioned it, but it's worth talking a little bit in more detail because, of course, the question of schools reopening is looming in Quebec, but parents everywhere are concerned about the risks, daycares in schools and all sorts of children together. So what is the research now on just how transmissible this is among children?
So a couple of things that we've learned recently. One is, as I mentioned, this study out of China where they really carefully traced all contacts, and then they did swabs. They really tested everybody, whether they were symptomatic or not. And their data suggests that kids are less likely to get the virus. So that's interesting. We didn't know that before. We also know that kids are less likely to be symptomatic, or at least severely symptomatic. That we've known for some time now from the emerging data on the types of patients presenting. There's another study that shows, recent study from Germany, that shows that even though kids may have less symptoms or even no symptoms, when you go in and measure the amount of virus in a child who has the virus, the amount of virus in their respiratory tract or in their nasal passages, it's actually very similar to the amount of virus that you would find in an adult, even a symptomatic adult. So what this tells us is that, yes, kids are less likely to get it, but the kids who do get it, even though they have less symptoms, they're likely just as infectious as adults because they have the same amount of virus. And the concern there is that now when we open up the schools again, these kids will be going in, very likely they'll be spreading it to one another. I think it'll be challenging to maintain that physical distance in schools. And then they'll start spreading it to the adults in their environment. So the folks working at the school, but then also when they come back home and to their parents. One of those studies, the Chinese study, did some modeling and suggested that even though kids get it less often, the closures of the schools probably reduced the severity of that peak number of cases by about 50%. And so the other side of that coin is that as we open schools up again, will we see another peak and another surge in our part of the world?
These are the kinds of findings that are just key to the decision-making around reopening. So, Dr. Gupta, thank you for helping us understand it better. Always good to see you. Thanks for our Wednesday session.
And you, take care.
Dr. Samir Gupta with us, respirologist, associate professor in the Department of Medicine at the University of Toronto.